Hello, my name is Jerry Wang, and I'd like to talk about our work on the neuropathological and clinical associations of late neuropathologic change in different age groups. Late is a prevalent brain pathology in individuals over 85, but it can also be seen in the brains of younger individuals. In this study, we wanted to compare late neuropathologic change in individuals over 90 and under 90 to determine if there are differences in association with co-pathologies and differences in contribution to cognitive impairment. Overall, we analyzed 313 participants from the Duke UNC ADRC, ranging from 60 to 106 years old. 203 of these participants were under 90 with a mean age of 76.8, and 110 of them were over 90 with a mean age of 94. There were significant differences in sex and cognitive status in these two age groups. In those under 90, about half of them are females, whereas in those over 90, females constitute 2/3 of the cohort. There was also a slight but significant increase in individuals with MCI or dementia in those over 90. ApoE4 carriers were slightly more prevalent in those under 90 at 36.8% compared to 28.8% in those over 90. However, this difference was not statistically significant. There was a striking difference in the proportion of individuals with late NC in these two age groups, 9.4% for those under 90 versus 30.9% in those over 90, a threefold difference. Also, there was more individuals with intermediate to high ADNC in those over 90. The difference in Lewy body disease was not significant. We then analyzed the associations of late with other common brain pathologies. In participants under 90, those with late neuropathologic change were also more likely to have arteriolosclerosis, AD neuropathologic change and intermediate to high, and also the presence of Lewy body disease. In contrast, in participants over 90, those with late NC also had a higher likelihood of having arteriolosclerosis, but not AD neuropathologic change or Lewy body disease. Notably, about 30% of individuals with late NC over 90 have no or low AD neuropathologic change. Next, to study the effect of mixed pathology on cognitive impairment, we performed logistic regression to study the associations between dementia and late neuropathologic change, AD neuropathologic change, Lewy body disease, and arteriolosclerosis. We found that in individuals under 90, AD neuropathologic change and Lewy body disease were associated with higher odds of having dementia. The effect of late NC was not statistically significant. On the contrary, in participants over 90, both late and AD neuropathologic change had an independent and significant contribution to the odds of having dementia. Overall, we see that 9.4% of individuals under 90 had late compared to 30.9% of individuals with over 90, a striking difference. Also, in individuals under 90, late NC was strongly associated with arteriolosclerosis as well as other neurodegenerative pathologies like AD neuropathologic change and Lewy body disease. Whereas in those above 90, late was strongly associated with arteriolosclerosis, but we did not observe a strong association with AD neuropathologic change or Lewy body disease. Moreover, in those over 90, participants with late but no or low AD neuropathologic change is common. In terms of the clinical phenotype, in those under 90, both ADNC and Lewy body disease increase the likelihood of having dementia. The effect of late was not statistically significant, whereas in those above 90, both AD neuropathologic change and late increase the likelihood of having dementia. With that, I would like to thank my collaborators, Dr. Sheng Luo and Yuanyuan Guo, who performed the statistical analysis, John Irvin, my lab manager, who did all of the immunohistochemistry, Jay Lusk, who is a very talented medical student who has been working with me on LATE for the past couple of years. Thank you very much.